Welcome to The Growing Dentist by Dr. Ali. In this video we will discuss diseases of pulp and periapical tissues. Inflammation of the pulp is known as pulpitis. Pulp can be inflamed due to bacteria, for example, if the tooth is cracked, carious, and malformed, or if there are periodontal pockets. This inflammation is also caused if the tooth undergoes any trauma, such as avulsions, root fractures, bruxism or abrasion. Iatrogenic factors that are responsible for pulpitis is mainly during cavity preparation. It can be either due to the depth of a cavity or with the heat that is generated during the procedure. Exposure of pulp or the filling materials can also cause such inflammation. Classification of pulpitis is based upon clinical features. There are two types: reversible and irreversible pulpitis. In reversible pulpitis, pulp is capable of recovery after the stimulants are removed. Irritated pulp tissue is responsive to earliest and slightest at inflammatory stimuli. To distinguish between reversible and irreversible pulpitis, the dentist has to make sure clinically, such as presence of a spontaneous pain, tooth responds on thermal changes, check the duration and nature of pain. Pain is sharp and intense. In reversible case, which remains for 5 to 10 minutes, may last longer than 20 minutes. Position of the body does not affect the pain. Its treatment involves protection of the pulp from thermal exposure, and sedative dressings are done in carious teeth. In irreversible pulpitis, pulp does not recover from the inflammatory stimuli until it is treated. Acute and chronic inflammatory changes are seen. Pain is of variable intensity, and is usually dull. It has less intense pain as compared to the reversible pulpitis. It is affected by patient's positioning, and difficult to localize it. Duration of pain lasts longer than 20 minutes. There are no changes seen on the dental radiograph. Acute pulpitis. It is of two types: focal acute pulpitis, which involves one horn of coronal pulp, and total acute pulpitis, that involves the entire pulp, which means both coronal and radicular are affected. It is caused by sudden overheating of the pulp, resulting in blood vessel rupture. This type of a condition is usually seen during crown preparation in the absence of a coolant. The normal temperature of a healthy pulp is 34 to 35 degrees. Let's get into the histopathology of acute pulpitis. It is similar to an abscess, hence also known to be as pulpal abscess, which is composed of a purulent exudate comprising of acute inflammatory cells, necrotic tissue, fibrin and extravasated red blood cells. Granulation tissue is also present, consisting of plump fibroblasts and plasma cells. Toxins are released by the invading pathogens, and the enzymes produced by the autolysing tissue destroy the remaining pulp. After necrosis, the exudate travels in the periapical area, and hence into the periodontium. From periodontium surrounding the cortical bones, the exudate invades the medullary bone. Chronic pulpitis is similar to chronic focal fibrosis. It occurs in older teeth, with many restoration or slowly progressive caries. These type of caries cause dentinal tubule sclerosis. These teeth also have reparative or secondary dentine, which form a barrier against invading pathogens, and hence slowing down the process. If we talk about its histopathology, it has a loose fibrocollagenous connective tissue, showing diffuse infiltration of lymphocytes and plasma cells throughout the pulp. This is termed as pulpal fibrosis. Two types of features may be seen in the pulp, if the fibrosis stays for a longer period of time. Firstly, pulp stones which are of spherical shape, and secondly, dystrophic calcifications, or linear calcifications. These calcifications may be present in both the coronal and root pulpal tissues. Prolonged chronic pulpitis leads to pulpal necrosis. Periapical lesions associated with it are asymptomatic. They are composed of a circumscribed nodule of fibrous nodule, with a mild infiltrate of lymphocytes and plasma cells. This is termed as periapical granuloma. Chronic hyperplastic pulpitis is confined to molars of young children, with large pulp chambers, and non-sclerotic dentinal tubules. It occurs as a result of rampant caries. The necrosis of the pulp after the caries leads to an open pulpitis. In young teeth, the apical foramina are open, leading to excessive blood supply. The regenerative capacity of the tissue along with the blood supply leads to a hyperplastic pulp. The pulpal tissue will proliferate out of the open carious lesion. The exposed tissue becomes fibrotic over time, which is asymptomatic, and of a normal color, which may get red if ulcerated or infected. It is also called a pulp polyp. For any questions or advice, the Growing Dentist team is always there to help.
Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.